Okay, we are live, Manushree. Hello, Manushree, we are live.
Yes, of course.
Okay.
Thank you. Hello, namaste, and good afternoon. This is Manashvi, and on behalf of ForOptom, I welcome you all to our ForOptom e-learning session. The ForOptom e-learning session is an initiative by ForOptom, and it is an interactive program where we discuss optometry topics. The session is live on YouTube, and if you have any queries, you can type them out in the conversation box, and we will be discussing them after the presentation. Today, we have with us Mr. Keyur Savla, who will be speaking on the topic literature review and proposal writing. A brief introduction to our speaker. Mr. Keyur Savla completed his Bachelor's of Optometry from Lotus College of Optometry in India in 2016. He then worked as a faculty at the Wavikar Eye Institute before getting accepted to the University of Alabama at Birmingham for a PhD. He is currently a rising fourth-year student under Dr. Andrew Pucker, working on toric multifocal contact lens for myopia control. So on behalf of ForOptom team, I welcome you, sir.
Thank you. Am I clearly audible?
Yes, sir.
Thank you, Manashwi, for the excellent introduction that summarizes probably all my work. But let's get directly into literature review and proposal writing. Before I start saying anything, I have a few disclosures to make. And these are that whatever I speak, these are my opinions and views, and in no way advocate like scientific generality. I do not endorse any of the products. If I suggest any programs or anything, I have no financial gains from any of those. It's just something that I've learned across my study, and all the image representative that are there on this PowerPoint are all available on Google, and that's my only source for these slides. So with that cleared out, let's get started. So the objectives of my talk are basically to help you understand what is literature review, who should be writing one, and the steps to conduct a literature review. And again, the same thing with what is a research proposal, the importance of a research proposal, as a lot of you would be applying for master's or PhD, or even for bachelor's, you would be at some point asked to write one, and how to write, or the writing of a research proposal. So I split this talk into two halves. Basically, the first half will speak a lot about literature review, and then we will speak a little bit about the research proposal in the second part. So with that, the literature review section, that is the most important part of research. As an established researcher, literature review is probably the first step that you come across. And again, at the same time, personally, and I know a lot of people find literature review and proposal writing the most dullest and the boring part of research. But unfortunately, most of us get introduced to research with this as the first step. I know data collection is all fun and happening, but this is the first step that most researchers have to go through, and this is the sort of weed remover, wherein if you cannot do a good literature review or proposal writing, then you probably are not meant for research. And it'll also sometimes put off potential researchers who might like data collection, but they get frustrated and annoyed with literature review. So I think all these problems arise just because we do not understand what one needs to do a literature review for, what exactly it is, and the skills required to do it, and how to approach it. And that's what I'm going to break down in today's talk, as to make it simpler for potential students, and help them understand what needs to be done to exactly master the skill set. So the first thing is, what is literature review? So literature review is a survey of scholarly resources. Now, a scholarly resource can be anything: a book, an article, a paper, anything that is being reviewed, anything that is out there in terms of spreading knowledge or scientific information. It is generally a part of a thesis or a research paper, to connect your work with the already existing information. So what it does is primarily it gives an introduction to your work as to, okay, this all is already known. what is available out there, and this is where we stand today, and hence I choose to go ahead with this topic for this and this reason, or etc. So it's a link, it's a connection between what is known for the readers, like you are explaining, okay, this is what we already know by all of these people or all of these scholarly works. And the last one of the other thing is it's a tool to identify the current edge of knowledge in a field or topic. So what do I mean by edge of knowledge? I will get back to it in a few slides later on, but it's like, what is the furthermost information about certain area that we know, and then you go ahead from that. And when you do a review, you don't necessarily have to write it. A lot of people think that doing a review means, fine, I have to write this 20-page paper, or even an introduction, a very long introduction. That is not necessarily always true. Doing a review can just be understanding a topic. So when you are, I don't know, looking for a product online, and if you go and read up some not scholarly articles per se, but even websites to understand what this product is, then uh, then that is actually doing a literature review of actually what is the information out there. So literature review in day-to-day life is actually much more common than we realize. If I say a word, or if I say a topic and you do not understand, and you do a Google search, quickly read about it on Wikipedia or any of the other sources, that you are actually trying to do is a literature review of what exists out there on that topic or that word. So yeah, literature review is just not limited to science, and you've been doing this for probably a lot of years. With that, having said that, and also I would like to add that literature review primarily, as this Google Scholar tagline goes, is stand on the shoulders of giants. And that's by Bernard of Chartres. And the whole point is that by giants, they mean previous predecessors, people who have done scientific advancement or any sort of advancement, even, for example, English literature like Shakespeare, and if any of the tools they have used to make their writing more effective. So those are the giants, and stand on the shoulder of them, as in, is to take their work as the first step, and stand on the shoulders of them, and look forward into the future, or look forward into more advancement. That is exactly what you're doing, is taking already known knowledge as the first step to look out into the unknown future, or unknown areas of science or knowledge. So what is the scientific edge? And that I would like to explain with this section. So who should do exactly in literature review? So as I said, literature reviews are much more common than you think, and anyone who wants to learn anything more about a topic should be doing a literature review. It can be a clinician, a student, an academician, or a patient. Even as a patient, if, for example, you have to advise someone for a cataract surgery, and they'll be like, you are an optometrist, you should know what lenses, what kind of intraocular lens I should tell my doctor to put into my eye. And then you'll be like, well, they taught us something about those, but we really don't do those, so I don't know anything. So at that point, you as an academician or a clinician, or even as a patient, if you're on the receiving end of the surgery, you would want to go ahead and do a literature search and find out what all the different types of lenses are, probably their pricing, the benefits, the pros and cons, and then you'll come across all of these um, tours of lenses when they are multifocals and preventing blue light dispersion, etc., etc. So that is, again, doing a literature review. And we have been doing this probably since we started to read. The only thing is that when you started to read in, first standard or whatever, that is the time they had already literature reviewed books formed for you. So they combine, like people who write these textbooks, they combine all the information available on a certain area or topic, summarize it in a chapter, and put it for you in a textbook, and all you need to do is read that textbook and understand. Of course, all of us might remember at some point in life we started using study guides and like Google at some point to understand and learn all of that information. That is nothing but doing a literature review, wherein you look at the textbook, you read the text, you're like, okay, I know the information in there. I'm trying to get a little more summarized information in this other form of text, which is commonly known as a study guide. And then from schools, you might have been given like a question answer set of question answers. And so that is nothing but doing a literature review, combining all of that information to understand one single topic. Um, and we have to understand the levels of knowledge. And this is where I come, where I was saying about the edge of scientific understanding. So on the right, you can see on the screen, there is a circle, a large circle, and that is a circle of human knowledge. So assume that this is everything in the world that we know and that we understand. It includes the gravity, the theory of relativity, all of optometry, and everything else that we know already. And of course, outside the circle are the things that we do not understand or we do not know. So when you're born and you finish your primary school or basic schooling, let's try and assume that this blue dot or this blue area in the center is the amount of knowledge that you understand. That is reading, writing, maths, numbers, and all of this. This is your basic knowledge, a little bit of basic science, history, geography, etc. And that is the knowledge that you finish your primary schooling with. Then after that, you go to secondary school or higher schooling, and then that knowledge is built upon. So you need to have the basic skills of reading, writing, numbers, etc., to add that additional knowledge or additional layers of knowledge. In this, you will get detailed science concepts, concepts of like social studies and all of that. And you probably even enhance your English and math skills. So that is your secondary or higher schooling. After that, you do a bachelor's or professional schooling. So I'm sure there are some places where you go to colleges and all of that. So I'm combining all of that and assuming that your first a year or so of professional schooling will be generalized knowledge, probably in optometry, like general anatomy, physiology, etc. And then you start a little bit into your specific area. So that bump on the peach circle is basically understanding contact lenses and binocular vision and all of that. And that bump is very specific because now you're trying to focus in a specific area of knowledge. Not everyone will understand that. So it's not a circle, it's not general knowledge or common knowledge, but yeah, this is a specific area and you will be trained for that in optometry especially, or any of the other bachelor's degree that you go into. But after that, this is probably what you do in your master's degree. So you choose a topic or an area or a field, say anterior segment diseases or contact lenses or retina and or glaucoma. And this is just one section or one topic that you would go ahead. And how do you cover this? What is this red part that you are studying or covering? How do you come across this? You actually are sitting down and doing literature reviews. You use multiple textbooks to understand the same topics. You probably go online and do a little bit of research. So this is where your master's degree comes in, wherein you progress a lot further. And now I'd like to take it ahead to the level of PhD as well. And a lot of times people ask me, what are you doing in PhD? Like, I've been here for 3 years. And I have like, well, I've just been reading basically. And they're like, well, you could have sat at home and done that. You didn't have to go and do a PhD, but that's what a PhD is, to understand. So the initial part for a PhD is to actually build that in that specific area a much more further. And this is a PhD's literature review, to actually understand what is all the information available in the current human knowledge in that particular area. And after that, you will come to an edge where you like come to questions where that's the lack of knowledge, or it's the edge of science that we do not understand really. For example, a very common question would be, we really do not understand why amblyopia happens exactly, not each and every time. We can create theories to try and understand from signs and symptoms we see, but not always do we know why it happens. So that is a lack of knowledge. That is the edge of our understanding. And then now you're trying to sit and develop a proposal. So this is just a magnified view of the previous diagram, wherein you're at the edge and you know all the information surrounding that point and you're developing a proposal. And once you've developed the proposal, which we'll come to in later on, all you do is you conduct research. And this is the real little tiny bump that a PhD student will do. So they will conduct research, answer one specific question or a couple of questions, and add this extra bit of information which wasn't there before. So we're really pushing the edge of knowledge or edge of understanding at this point. And one has to really understand, in a large perspective of things, a PhD is basically nothing but making that tiny change or tiny bump in the circle of knowledge. And that is exactly what research is. So literature review is actually building yourself up to that edge to understand what questions are unanswered. And so anyone and everyone can, should, and must be doing literature reviews at some point. So enough of that, and I'll get straight into how to do one, because I think most of us are really interested to understand about this. And so steps to conduct a literature review. One is to select a topic, area, or field. The next is to search the literature out there. So selecting a topic, I would recommend do it on your area of interest. Something that you really like to enjoy or learn about, because if there's a topic that you hate, then it's no point trying to read about it, because you're really going to be miserable when you're trying to get more information. The next one is to search the literature. This can be done in a lot of ways. Primarily, you will start with books. If you do not know, you would come up to a certain level with the books available to you, and then you would go online, probably Google Scholar, PubMed, Scopus, and there are a lot of other tools available out there. PubMed, I know in Southeast Asia, is the most common one. It is also free, and it is an excellent tool. So yeah, learn to use that. Next is to read and analyze the information. This is where I feel a lot of us struggle, wherein we are probably in our bachelor's or starting our master's, and we are expected to understand all of this scientific content without having much introduction to it. So this is where I would focus a little bit on the next slide. The fourth is to develop an argument, as in to say, okay, this is what we know, this is what we don't know, this is what we don't know, and why we don't know. Also, sometimes state like why we should know this information, because there's a lot of information that can be had out there. But the question is, do we really need to know all that information at this current point in time and age? We need to prioritize. So that is developing your argument to say what we need to know. And the next is to write the review. This is not necessary always, as I've said earlier, but yeah, most of the times you will want to write that information that you've collected or formulated. But first, know the purpose of the review. That is the most important part. So the reason I spent so much time on the levels of knowledge is because you have to understand what is the purpose of your literature review. If you're just trying to figure out what contact lens you should buy next, then you really don't need to do a lot of these. But if you're trying to develop a bachelor's thesis, then you need to understand some of these and develop a certain level of argument. For a master's, it would go much higher. For a PhD, it would go even further on. So understanding that purpose is the primary step. And after that, of course, you can do all of these steps and you will be focused into what you should be doing. So moving on. So that, as I said, the purpose, the right, you can see there are types of literature reviews. So these are the basic or the ones that you come across more often. And that is, it can be a part of a larger work, which is introduction to a journal article. When you write papers, you have to do an introduction. And for that introduction, you would basically be doing a literature review or dissertation on thesis. So your first two chapters or first chapter is just going to be an introduction, basically, for your dissertation and thesis. So it's a part of a larger work. So that is the purpose of the review, is to introduce something. It could be a standalone work itself, like a review article, wherein you review all the information out there and just put that in an article and publish that article for a summarized version of the information. Or it could be a standalone work, as in a course assessment, wherein you assess like a particular type of, say, contact lens or etc., and you do that as a standalone work. So this standalone work would be selective because you're only going to pick on that contact lens and that wearing modality and just study that. Or for example, an introduction to the journal article will also be selective because your article doesn't speak about everything in the world, or even under a topic, it is very specific. So you need to pick out only resources very particular to that. But a thesis, a dissertation or thesis, and a review article are much more comprehensive, wherein they cover almost all the topics or all the subtopics under one particular topic. So when I say myopia, and of course we'll hear a lot about myopia because that's my area of work, I'm going to cover almost everything that is there under it a little bit. It's going to be a comprehensive information if I write a dissertation thesis, when I write a dissertation thesis. So yeah. So some of the tips that you need to do, tips that will help you with literature, is first to know your topic or area, the scientific basics. And if you do not know that, your best place is to start with summarized textbooks that are already out there. They have summarized the information, and you need to know the basics. If you start reading scientific papers without understanding the basics, you are going to be a lost lamb, and you will not understand what the hell is going on in that paper. The next is to use a database, probably PubMed, as I said. And I think as a student, I had the disadvantage of not knowing what Boolean logic was. So Boolean logic, if you've come across, is nothing but the words and, not, and or. So using these words between two topics in capitals in any kind of search database will give you different outcomes. So for example, I am studying toric contact lenses in myopia control. So if I write myopia control and with and in capital toric lenses, so anything that come up, all the searches that PubMed or Google Scholar will do will have both those words or key phrases in the answer. So they will have this and this. If I use myopia control or toric contact lenses, which means every article that is published about myopia control or every article that is published about toric contact lenses. Now, these toric contact lenses could be even to correct keratoconus, for example. Both of those will be added up and shown. It won't be like both those terms are necessary in each article, but either of those terms will be added up. And again, in the or in the center has to be in capitals because that's how the databases understand. And not is where myopia control, not toric contact lenses, means all myopia control articles which do not have toric contact lenses. So anything which has toric contact lenses inside that myopia control article will be excluded, and that will show up. And that helps you, you can build on this. You can add 2, 3, 4 terms, add ands or nots and or and all combinations, and refine your literature search so that you're only looking or scrolling through articles that are important to you and not everything under the sun, because there is a lot of information published out there. The next is, if you really do not know the topic or if you haven't understood the scientific edge, it is very easy to get lost in individual papers because they only answer one particular question. So it's necessary that you look at a systematic review or a review of the area, wherein, for example, Cochrane Eye is a review database that is like authorized to do reviews in the field of eye. So see if there is a review about it. For example, Myopia has one which was published in January 2020. And if not, I'm pretty sure someone else has a review done outside, and that will give you a comprehensive overall view of the information. Of course, at a PhD, you're expected to read the whole review and know everything in it. At a master's level, probably also so read the whole review, not know everything. At a bachelor's level, if your review article shows up to be like 80 pages long, which is highly likely because that's how some of them are, then your first will be, oh, I don't want to read this. I might as well read the 10 page long paper because I don't have time to read 80 pages, which is correct. You do not really have time. So at least scroll down to the section you are interested in. If it's a review about anterior segment and you're only interested in dry eye, scroll down to that section and read through that. Next is an important tip is to make your work recent. By recent, I mean, if you're looking for dry eye and if you're reading some article that was published in 1940 and you're trying to form or understanding of your bachelor's thesis, you're probably doing something wrong because anything that was published in 1940, not saying that that is wrong, and unless you want to go that far down to understand the root or the start of this problem. For your current review to get to the edge of scientific understanding, you probably need to be reading something much more recent. And depending on how common the topic is, that definition of recent might change. Something in myopia, even the last 2 or 3 years is recent, and anyone who ends up reading content from the last 2 or 3 years will be up to date. For something which is not so common or which is much rare, like keratoconus or etc., not a lot of work is being done on a day-to-day basis. You might want to extend that timeline to say 5 years or 10 years because not a lot is published. So yeah, you have to understand what is recent for your work and read accordingly. So don't waste time reading something that is super ancient and will not contribute or will not help you understand the edge of knowledge. The next is when you start reading, say for a systematic review or even individual papers, especially in a systematic review, I would say identify the key ideas. That each topic has certain 5 or 6 ideas that there are different researchers across the world trying to advance or understand. For example, in myopia, it would be what is the effect of outdoor time spent? What is the effect of these optical interventions like contact lenses and multifocal contact lenses, etc. The other is what is the effect of pharmacological agents like atropine. And these are some of the key ideas. Like one of the other one would be genetics, how genetics plays a role. So these are some of the key ideas. You can actually summarize all of myopia control or management just using these 4 or 5 terms. So you have to identify those key ideas because even though I work in myopia, I would have no shame in admitting I have no idea of what happens in genetics or with outdoor times. I have a little bit of understanding, but these are not my areas of focus. So I only understand primarily optical interventions. And so but I do know the key ideas, and that's how I came down to optical intervention, because I understood, okay, these are the focuses that people are working on. What do I want to work on? Once I've decided, okay, optical intervention seems to be something I'm interested in, you want to be reading specific papers on those key ideas itself. Like if you are confused, you want to read 1 or 2 papers on all of them. But if you're not, and if you've decided, don't waste your time as a bachelor student reading about all of it. Yes, I know your faculty like, you should know everything and that's your area. I can really understand that, but we have a life outside of this. So yeah, it's important to focus your work into understanding that one particular topic or question and understand how far they've gone in that. Yes, all the knowledge in the world is not enough, and you should always be learning, but at the same time, you should also be focused. And then next, one thing I want to say is where a lot of students fail is to summarize that information. We go down this rabbit hole wherein you're reading a paper, you find a reference to a point and you're like, this is exactly I wanted. And you open that next paper, and in that paper, you do the same thing. And you've read about like 10 papers. And now you remember that there was this idea in paper number 3 or paper number 4, wherein you thought it would be very important, but you don't know which was paper number 3, which was paper number 4. You have no idea where that paper you had found it, what journal it was. You just remember that this has been found or this has been done. And at that point, you are starting from scratch again because you cannot find that particular paper. One is learning how to use your database would help, but 2, even better than that, is to summarize the information. There are a lot of ways to do this. People use Word documents, people use Excel files and use tables. But I think Excel files and tables is the most easiest way for a starting researcher. There is something called as Roam Research, which is a new tool. I don't know how freely it is available, but that is also an excellent tool to summarize and connect this information. But it has a bit of a learning curve. So you might want to do a few YouTube videos before you get there. Also, with understanding how to use databases like PubMed, etc., how to filter your research to certain years and only systematic reviews, just use a YouTube video and understand how to use PubMed before starting to use PubMed, because that will save you a ton of time figuring out what you need. So that is summarizing the information. The key points would be what year it was published, probably the name of the first author, the title, and the journal. the journal it was published in, and then the ideas that you liked or something about the methods, depending on what your focus is. Even in optical interventions in myopia, my focus can just be measuring those refractive errors, and I have nothing else to do. So you need to focus down on what you really like and what you want to read about. So that is all about it. And then the last, depending on if you have to write or not write a review, you write the review. That is the next most important step. Now, for writing the review, I think it is important to understand for you to read a research paper. And I know a lot of my community, like the scientific community, will disagree with this information and they'll be like, you're teaching them wrong. But as a bachelor's, I would have been really blessed if I understood the anatomy and physiology of the research paper. I have spent tons and tons of hours reading papers that are unnecessary to me. And I think understanding the anatomy and physiology of the research paper can help you read a 10-page research paper in 5 minutes or even less, and figure out whether I need to really understand this paper or just get a brief knowledge of what this paper is talking about and move on. So these are probably the papers that will not go into review, but at the same time, you're not sure looking at the title whether it is a useful paper or whether you really need to read it. And especially in large topics like myopia, where there are tons of papers being published every single day, having this kind of an understanding to read a paper is very important to keep up with the literature. At the same time, this is no shortcut to doing a literature review. You would still have to read the whole paper, as always, because I've done this mistake and I've realized it the hard way, that you have to read the whole paper. If you're citing it, you have to know each and every word on that paper. But if you're not citing it and you're still not sure if you need to read it, then this is something that helps. So I would like to actually speak about the abstract. You have to read the abstract first. I would like to speak about these points and probably take 5 minutes to review a paper I just downloaded this morning that I'm planning to read throughout the day today, and show you how this can really work very quickly. The primary bottom line of this, all of this, is you have to have a basic understanding of the topic. You cannot just be blank, get up one day and read a paper like this. You have to have some basic literature, and on that you can develop. First, read an abstract and understand the PICO. PICO is nothing but problem, patient, or population, which stands for P, intervention or indicator, I, C is comparison, and O is outcome. So you have to understand who is the patient, like what is the patient, problem, or population that the paper is trying to answer. Intervention, what they're trying to do, like are they fitting contact lenses, or giving them a drug or something like that. Comparison, who is their comparison group, what are they comparing to? Okay, this was done previously and now this is done, or there are two groups. And the outcome, what outcomes they are trying to measure. And sometimes in the results you will of course, most of the times in the result you will also have the outcome itself. The next is introduction, where you read the first and the last lines of most of the paragraphs. And again, I'm hoping that you know some of the literature already in this area. So, and that's when you start. So you read the first and last lines and you will get the gist of what the author is trying to talk about. And of course, you always must read the last paragraph, because that is a paragraph that says what this paper is going to be talking about. And it is important to understand that in some fields, in optometry, most of the papers follow this style, but in some fields, the paper might follow a different style. And if an author is not well established or not well read, they might not write it exactly the same. So it will get trickier to read. But if you start with well cited papers, they will all follow the style, and that will help you understand the difficult ones, wherein it's not written the same way. You will develop tricks how to do it. Methods is the next. And in this, you first look at the images. If there are any images, that is your primary area. And what you're trying to understand is, again, the PICO details, what and if any details that come out of it. Inclusion, exclusion criteria, you want to look for this, and the outcomes, again, what outcomes were they measured. Results, images, just look at the images. That will probably give you all the primary results. And at the most, you want to read the first and the last lines of all the paragraphs. Discussion, again, results is the first thing that they will do. In the first paragraph, they will, in short, tell you the results. And same as results, you read the first and the last line of the whole thing. The second paragraph would be establishing or stating about studies that are same as their studies. The next one would probably be about the contrasting results, as in some studies that show the opposite information as their studies. Then you can have n number of paragraphs using different thoughts, theories of why this happens, relation to their results, and explanation why they think it could have been the cause that their results turned out this way. And one of the last things they would do is limitations. And sometimes you have a separate conclusion, sometimes you don't. It could be a part of the discussion. So that's how, that is the anatomy and physiology of a research paper. And this you can use and in 5 minutes understand the whole research paper. And I have one that I downloaded this morning. And I'd like to take you through it so that you can understand how this is done exactly. So this paper won an award recently on in American Academy of Optometry. And so it's a very well-written paper, I can tell for sure before I start reading it too. So it's myopia control with bifocal contact lenses, the randomized clinical trial. We know, reading the title, what this paper is going to talk about. So we go through the abstract. I'm going to make it quick because I know that this is a time-limited search of this paper. So the first thing you want to look for is PICO. So this was, the control study was 1 year. Okay. So 86 myopic subjects, that's my population. This is the age, 8 to 18 years over here. So I'm just going to see if I can use a highlighter much more effectively. And of these, 79 completed. Okay, fine. I don't care about that right now. You don't really want to focus on these tiny numbers if that is not what you're exactly looking for. Okay, they used intervention, were randomly assigned to wear either Vistakon AccuView or Vistakon AccuView bifocal. So, okay, now I know what are the intervention they used. Okay, results. This will help me understand. So these were the intervention or comparison that they used, and my outcomes would be significantly slowed myopia progression. So they are going to look for myopia progression and in treatment group after 6 months and 12 months. So I know they're looking at 6 months and 12 months. And I can see diopters, means they calculated somehow refractive error, and I can see mm and axial length changes. Okay, so I know the outcomes. Of course, reading the conclusion statement is the most important. So distance center bifocal contact lenses tested in the study achieved greater control over myopia progression. Okay, so the contact lenses that were studied are better. And more than 70%, that's a huge number for myopia control, compared with most published results with multifocal spectacles. So they are arguing spectacles are not that great as compared to contact lenses. And further studies are warranted to identify the critical factors and mechanism underlying myopia control effect. Perfect. At this point, you will know if you really want to read the rest of this paper. And if this is not something you are into, you'll be like, okay, I got the gist, I'm going to move on. But if you are really wanting to read this paper, then first and last lines of each paragraph's introduction. So myopia is a focus of growing attention and concern because of the now extremely high prevalence. Anyone who studies myopia is known that, okay, this is the prevalence. So we know that the first paragraph is primarily talking about prevalence, and I can see some numbers and percentages. So I'm just going to skip to the last line. Myopes are at an increased risk of maculopathy, etc., 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 leading cause of monocular blindness. Okay, so now I know that the first paragraph is telling me prevalence and why this is a problem. The second paragraph, the rapidly changing myopia prevalence figures are consistent with, okay, so the second paragraph is telling me why there is an change in this myopia prevalence. Its environment plays in the development of myopia, the roles of environment. Okay, the last line, although unresolved are specific factors, so we don't know exactly all those factors. Visual experiences seems to play a central role and has refocused attention. Myopia progression should be controlled. Okay, so they are talking about how they can control it. Studies involving animal models for myopia, etc., etc. Compelling evidence for active emmetropization and the role of optical defocus in ocular growth modulation. So now we know that it can be controlled from this paragraph, and we know they're going to talk about optical defocus. Last line, for and using animals primarily. For already myopic eyes, both stabilization of myopia and reversal has been described. So they show that with in animals, the eyes that are myopic, you can stop the myopia or stabilize it and reverse it also. The above animal models translated to human myopia raise the possibility, okay, so now they're going to talk about from their animals to humans, how it's going to connect. And in the last line, we're going to, which produces a relative myopic shift. Now, you have to have understood the myopia literature up to a certain extent to understand what is relative myopic shift. If this is something that interests you at this point, you want to write it down, Google it up before you go ahead. Relative myopic shift in peripheral retinal defocus. Okay, so they're going to use peripheral retinal defocus, and that we could tell somewhat from the bifocal contact lenses. Next, the control of nearsighted trial. Okay, this is control trial with soft contact lenses compared. Okay, so this is narrowing down to their topic now, that this particular trial has been listed over here. Okay, in the last, the results with the subgroup analysis from COMET trial revealed that subjects with near esophoria to be among the ones that, okay, now we know that they are trying to focus down onto myopia in people with esophoria. We report a highly clinical and statistical difference exceeding results. Okay, so this is probably talking about the control trial to date, reflecting slowing of, okay, so we know this is about, okay, so this is the last paragraph. So you really want to read it through. We report here highly clinical and statistical significant slowing of myopia progression with bifocal soft contact lenses exceeding results, etc., etc. The slowing of elongation as compared to single vision. The study design and results are described in the following sections, and the implications are discussed in the context of underlying mechanisms. The study results have also been reported in the abstract from previously. So we know that this paper is going to talk about the implications and the potential underlying mechanism. At this point is a good stopping point and deciding, okay, do I really want to read this? Probably, no, yes, okay. Now, we've already understood PICO from the abstract, so you don't really need to go through the methods unless you want to get into some specific details. Like you can see over here, these are the, just glancing through it, that these are something that they have looked at, which is age, refractive error, amount of ESO associated nearphoria. So esophoria for near, basically I'm assuming sex, and Asian versus non-Asian ethnicity, etc. So they're going to focus on all of these things. But apart from that, I'm just at this point going to skip over to subject selection. And these numbers, as soon as I see, I know they're describing the amount of myopia. So this is probably inclusion-exclusion criteria. Eligible subjects were limited to, as I said. Of course, and then somewhere along the line, they will come down to exclusion criteria. And of course, there's a lot of it which with like last eye exams and progressed by. And so these words are striking something in my head. I already know that they're going to be looking for. I don't see the word exclusion anywhere clearly. So what you can quickly do is Control F and find EXCLUS. And yep, specific exclusion criteria included any pathology. Okay, so yeah, we know the exclusion criteria. At this point, I will move on to study methods, baseline measurements, refraction, ocular biometry, keratometry, and nearphorias. Okay, we know that. I really don't want to understand right now how they did it, because I want to get into, okay, I know Zeiss, IOL master, so that's probably used for axial measurements. Here I see NITEC macro arc autorefractor, that's used for their refractive error and probably even peripheral refraction if they did it. And here a Bernal near point, examination card, perfect. So I know how they did it, most of it. Statistical analysis, at this point, I just want to see if they've done anything additional. So I see over here 2 primary outcomes, perfect, exactly explained as I wanted. Changes from baseline to spherical equivalent refractive error and cycloplegic autorefraction. Axial length, both parameters objective and thus free of subjective biases. Okay. Primary outcome data for left eye, right eye, no significant differences at 6 months, 12 months. And finally, multivariate analysis of variance were used to examine influence on treatment outcomes, various factors, including. Now,
I'm sorry to interrupt you. I'm sorry to interrupt you. Keyur, could we zoom on that?
Oh, sorry. Thank you. I mean, should have mentioned before. Perfect. I'll go this way. Is this better?
Yes, perfect.
Okay. So sorry about that. This paper is available out there. So you can just download it and go through it, but I will keep going right now in interest of time. So here I can see age, sex, baseline, refractive error. So these are the different factors they might have looked at. In results, as I said, unless you are interested in the details, which I'm not at this point, just go to the images or the figures. And here I can see refractive error, refractive development, bifocal single vision, 6 months and 12 months. So this is for 6 months, this is for 12 months. And this is refractive development, this is axial elongation. This is 0 and this is minus. So this is probably relative change. So we know that with bifocal at 6 months, you have to understand, of course, what is a Bosque and viscous plot before you can understand all of these details. But assuming you already know that, it's less change. Over here, it's more change. The same with at 12 months, it's very little change from 6 months, and single vision even progresses further. Of course, this plot also tells me that there are some patients that did not change at all, and they were like, almost probably similar. With axial elongations, this is 0 and this is increased length. So with single vision, I can see that the length has increased. With single vision, again, I can see that the length has increased. But of course, the variability is very high. So I guess that's the primary two outcomes that they were going to measure, as they said, and I've understood the outcomes. So I'm going to move to the discussion section. As I said, the first paragraph is just going to be telling their results. So sometimes it's always helpful just to read this. Compelling evidence of these contact lenses. Strong myopia control effect found in this study. That is an overall 72% reduction in progression based in refraction and 80% reduction at the rate of axial length. So we now know that important outcome from this 72% for refractive error and 80% in axial length. We go ahead to the second side, and we are seeing that controlled and optical intervention treatments were randomly assigned with all of these. Okay. Yeah, I don't see anything that stands out to me, so I'm just going to skip ahead. The large control effect reported here contrasts with what somewhat small effects reported in 2 common studies. As I said, the second paragraph will be in contrast. So if you are writing a paper or trying to find information about something that is not working in myopia control, now you know that these are the references, and you should look up 45 and 46 later on in the references, and probably you would read this paragraph much slower than I am going through. But of course, that is not what I'm looking for right now. So I'll go to the last line of this paragraph, and the myopia control effect of such lenses would be improved further if during near viewing non-presbyopic wearers did not reduce their accommodation as reported in 2 of the studies above. So now if you want to understand the reasoning of why this study is failed or has been contrasted, this is the paragraph you want to read. The other study I think they're talking about is DISC study. Of course, me having read some of these already know what the COMET and the DISC study are, so it goes much faster. So this was, I think, talking about refractive error, because now I can see they're talking about axial length in the second one, in which they, of course, use the ATOM study, which is the atropine trial. And of course, axial length is important, but that is not something I'm looking for. So I am going to go down to the end of the paragraph, which I believe is here. So I think suffice to say, it remains beyond scope to report conclusively, identify the mechanism of underlying the observed reduction in axial length in otherwise growing children. So they are trying to say that we need to identify the mechanism, I guess, in this. So now if you are trying to look for a research topic, this is a great research topic. In your bachelor's thesis, probably not, but probably for master's or something like that. And the last is, of course, as I said, limitations. So these are the limitations. Again, this is a very good area to search for new research topics, because this states that something this study has not been able to do, which you can do. And they will always have a future studies section. Should aim for more balanced representation by sex and include wider range of ethnicities. So you know that this study was not in that sense. And yeah, finally, it will also be important to understand early intervention influences the course of later progression and discontinuation of treatment. So yeah, these are some really important topics that we do not know in myopia here. And this is what exactly the study is stating. And conclusions. AccuView bifocal soft contact lenses, neutralize near associated esophoria in children. So we know that these are good to treat esophoria in children, and effective in limiting the rate of progression of myopia and axial elongation during a 12-month period. Understanding the specific factors contributing to the efficacy of this contact lens design in controlling myopia progression will be important for refining related clinical protocols. Here is your research question for a future study. And of course, acknowledgements and references. If anything stood out and you read the whole paragraph, you want to get those references out, go back and start reading these papers. But if you're planning to use this paper, the first thing you should do is go to your table, put down the title and whatever stood out and the important information before you forget it. So yeah, once I read this paper in detail, I'm going to do exactly that today after this talk. So with that, I know it's being super long, but yeah, that is the end of literature review. And I will pause for any questions before I quickly summarize the proposal writing. Are there any questions at this point?
Yes, we have received a couple of questions. So Ms. Uma Maheshwari asks, so whenever we do review, if there are 3 to 4 researchers which are quite similar to each other, so should we mention all the reviews in the thesis or not?
Excellent question. I will detail about this in proposal writing a little more, but at the same time, knowing that there are 3 to 4 researchers is very, very important. The level at which you are writing, if you're writing a proposal and it has to be finished in 500 words, you probably don't want to cite all of them. If you're writing a dissertation thesis, you probably want to find more than 3 to 4 reviews, 3 to 4 papers, because then you want to cite everything possible out there. Not everything, but still a lot more. So yeah, it depends at which level and what is the word length you're writing. Like in an abstract, you rarely see any citations, but in the introduction, yes. So mostly depends on the word length and how important those 3 to 4 papers are to your topic. If they are something talking about peripheral refraction, measurement method, this paper would not have cited it that we just went through. But if they're talking about contact lenses somehow, or the particular population, then this paper would have cited all those 3 to 4 reviews. So you want to have decent citations, but not everything under the sun. And also a good way to screen your citations is you give priority to the papers that have been cited the most, because those will be known well by the audience and they will understand. Like COMET and DIS studies, I'm pretty sure there are a lot of other studies, but COMET and DIS study or control trials are the big ones known in myopia, ATOM study for that matter. And those should be given priority because a lot of people while reading it, as soon as I read ATOM, I know what they kind of said, so I can go on. And so that's how people will be less confused over there. So yeah, that's the short version of it.
All right, we have the next question from Mr. Pakun Ghosh, who asks, for dissertation style manuscript writing, how many background literature reviews are needed to be cited?
Again, dissertation at what level? A bachelor's level, a master's level, a PhD level. A PhD level, probably your total citations, I don't know about background literature, but your overall citations would go upwards of 300, 400. For a bachelor's level, even 50, 60 is, I think, decent. You have to understand how much time you're putting into that research. And there is no minimum or maximum. The goal is to make sure that you understand the information out there related to your particular topic. So yeah, I have seen dissertation thesis with 20 citations, and I have seen dissertation thesis with 500, 600 citations. So it really depends on how much information is out there and the information that you're trying to summarize. There is no number that I can give, but of course, it goes without saying that a bachelor's would have less than a master's would have less than a PhD. So yeah.
So he's just clarified, he wants to know it for a bachelor's level.
So for a bachelor's level, again, as I said, depends. Like when I wrote my myopia bachelor's thesis, I believe I had like 70 plus citations. And it's not the number that matters. What really matters is for each point you are stating in your introduction, that if you're stating a fact saying, this is what happens, myopia is an environmental factor. Myopia can be caused because of the environment. You need 1 or 2 citations for that fact. That's it. Move on. You don't need to cite everything under the sun. But for each fact or each standing on the shoulders of giant that you're doing, you need to specify the giant. Who's this giant that has given you this information? And you move on to the next. So yeah, depending on how long your introduction is and what all points you need to cover, give 2 or 3 citations for each point. And for anything that is directly related to your topic, you need to have like a little more. So it doesn't depend on the length, but or the number. It really matters. But if you still want to get a number out of me, I would still give you a vast range, somewhere between 20 to 70. But again, this is arbitrary. There is no limit as such.
All right, we're done with the questions for now, so we can move ahead.
Yeah, proposal writing. So again, in proposal writing, now one needs to understand primarily the most important part is the purpose of this proposal. Is it a bachelor's, master's, PhDs, PhDs proposals, or even grants? Like in US, I know R01 grants. These are big grants written for 5 years plus of research, and these can extend into like tens of hundreds of pages sometimes. So yeah, you need to understand the purpose. That is the first and the most important thing of your proposal. Why are you trying to write it? Okay, so the first thing is, what is a research proposal? So it's a document proposing a research project, as the name itself suggests, that what research project you want to do, and this is the document summarizing that. As I said, there are different levels and styles of it. You could be writing a research proposal for a systematic review. You could be writing for a case control study. You could be writing one for a randomized clinical trial. And so those are different styles. I cannot go into all those styles, but you need to study or understand your style. You don't need to study all of them right now, but study and understand what is your style of research, and just focus on writing a proposal for that. Consists the same basic ideas as the anatomy and physiology of the research paper. So you are going to mention who is going to be your population. Is it going to be kids? Is it going to be adults? Is it going to be elderly? What is going to be your intervention? Are you going to use contact lenses? Is it a surgery? Is it a test? Is it an exercise? What is going to be your comparison? What is going to be your control group, etc.? Is it going to be patients who've been seen in the past? So are you going to dig up those past clinical records? Are you going to do 2 groups? Or are you going to not do any groups and compare it to the data already available or published out there? And outcomes. This is one of the most important thing that students struggle with always while designing research, is the outcome. You have to specify exactly how you are going to measure your outcomes. Is it going to be the refractive error? But refractive error measured how? Retinoscopy, objectively? If objectively, then what machine? If subjectively, then what techniques are you going to use? So this is very important, is to understand the outcomes clearly. So yeah, that is basically all of it that your research proposal should consist of. And it should, at the same time, outside of this purview, and this depends on your level. At bachelor's, they might not ask you for like, how much money is this going to cost? At PhD, probably. So permission to do it, approval, requesting approval, money, probably the time, depending on where you are and what you're doing, these things might change. So the importance of a research proposal is it's a planning template. It's basically a game plan for what you're going to be doing. It helps assess the pitfalls and shortcomings of a project. So if I look at a research proposal, I can be like, well, I think this is where it's going to go wrong. This is probably the area we need to focus more on, or this is not going to work, etc. It's also an assessment of the knowledge and understanding at times. Okay, these are not always there, but a PhD research proposal or a grant research proposal, a lot of it is literature review. So it helps us, helps the reviewer understand, okay, the student, does he know what he's talking about? Does he actually know the literature out there, or he's just writing a research proposal and has no clue what is happening in the field? So it's also an assessment for that. So understand the purpose of your research proposal and focus accordingly. If you are expecting your research proposal to be judged on the knowledge and understanding you have, then please make sure you do a good job with that area. It provides an estimate of the workflow. Like first you're going to recruit patients, and then after 6 months you're going to do this, or in 1 week you're going to do that, and etc. The resources required, you will require chair time or the clinic time for 2 hours or 1 hour, and the time required, like timelines. This project can be done in 6 months, 8 months, 5 years, probably never, things like that. So that is the whole importance of a research proposal. And the reason I'm stressing this is to make sure you understand what information to give to your reviewer. If these are the importance, or this is something that they're looking for, you put that in your proposal and they'll be happy with your proposal because it answers their questions satisfactorily. So writing a research proposal, the most important, I cannot stress how important this is, get a proposal template. Even better, an example. If your school or college is asking for a proposal, tell them, is there a template? Like, what all do I need to mention, etc.? Or is there an example of a senior student having done that? If they don't give you one, ask a senior student yourself to help with their approved proposal. These are some things that will be there, probably aims and objectives, and not always will be there, but yeah, scientific reasoning and innovation. So what is your goal? That is the first thing. What is your scientific reasoning? Why you want to do this? Impact and application, how this will help the world out there. What can you do once you found out the answer? Proposed methods, who is your population, etc. Sometimes it can be renamed as inclusion exclusion criteria as well, but they really want to know proposed methods as to how you're going to do this. Statistical details, sample size. A lot of places ask for this, and a lot of students are baffled by this. There are certain softwares out there, and I'm not sure if there is another talk specifically dedicated to this, but you want to spend time. If they're asking for sample size, they just don't want you to give a number 20. They want you to justify how you figured out that number also. So the next is expected outcomes, means they are asking you to anticipate what will happen at the end of the research. Do you think this will happen, or do you think that will happen? And resources and timeline, like what all do you need? Do you need the space? Do you need this machine? And what is the timeline you're anticipating to finish this? So these are some of the important things that you need in your research proposal. But of course, a template and example will help you best with it. Again, the next part is writing a research proposal. These are some of the tips. One is get keywords and phrases right. So some like Control F should help you identify the outcomes. If that is what your template is asking for, state clearly the inclusion and exclusion criteria. Then use the words inclusion criteria, bullet or whatever, a paragraph, exclusion criteria, whatever paragraph. Make sure that you're using the keywords from the templates, aims and objectives. So use exactly those same words. Or innovation and proposal. So it doesn't have to, in significance and innovation. So in your paragraph, you don't have to specifically state like with headings, but somewhere in your introduction paragraph, this project is going to be innovative, as in it will provide this new thing that we did not have before. So something like that, or this project will be significant because it will help the population of so-and-so country or the optometrist in so-and-so country to do this and this. So use those keywords. Referencing and citation, very important. Any kind of research proposal, if it has even a little bit of literature review, you have to have references and citation. I will not go into details on how to do that because I know there is another session. So please chime in into ForOptom for more information on referencing and citation. Answer the most common issues. Sometimes answering like the important issues that your project will face. Like for example, you're looking for 90 to 100 years old for whatever reason to do so-and-so project. The biggest common issue everyone is going to have in mind is where are you going to find your population? So even though it is not asked in your template, answer that in your methods that you are going to recruit this from an old age home or whatever, answer those most common obvious issues in your proposal. So when you're defending or if someone is reading it, they aren't like, this is never going to happen, because they haven't thought about the problem as you have. You've thought about it and you have a solution. So answer it in your proposal. If there are guidelines or templates, stick to it. If they've not asked for certain information, do not beat about the bush and give them that information. A well-written proposal is not which is very long and has everything in it, but which has the least, all the information packed in the least amount of space. also understand this committee. The next is to know your committee and their strengths. So if you can find out who's going to be looking at your proposals, know know that committee, know their strengths as in their area of expertise, how much time, if you have like 50 students in your college and everyone's submitting a proposal, understand your committee is not going to have like 1 hour to read your proposal. So write it accordingly, give them the information that they need. You can use simple formatting tools like bold and highlighting and italics and underline to make sure that they see that innovation point right in the middle of this big ass paragraph, wherein they can just read that one sentence and understand the whole gist. And strike a balance between the expert and novice in you. So sometimes you have to understand that your committee is not going to be all experts. It could be a lay audience also. So strike a balance between that. Someone who is probably just a statistician, but does need to understand the science behind your proposal. So you have to make sure that you're not using extensively high languages and very jargony terms which no one will understand except for experts in that field. So you have to strike that balance. But again, for that, it's important to know your committee and their strengths. And finally, a proposal, if it's not written, it didn't happen. So I know sometimes you just don't have to write a proposal at like a bachelor's level. It doesn't mean that you do not write it. Just take these pointers and sit down and write it on a piece of paper or in a Word document to make sure that you have all the information before you make the PPT, because I know sometimes you just need to present it. At the same time, when you're doing this, for anything that can be questioned, one of the things that I have come across often is students know that, oh, there is this study that has done this exact same thing, and they know it didn't happen. That's why I'm not doing it. But that is when you're presenting your proposal, stating that there is this study that has done the exact same thing, it didn't happen, is no help. You have to be able to tell the author or the publication or the journal or the year. And as soon as you open your mouth with those details, your committee is going to be like, okay, the student knows what they're talking about and they've read the literature out there. And then no one is going to then question you, because understand, if it's not a committee of experts for example, if it's not a committee of experts for me in myopia itself, which at a PhD level, hopefully your focus is a committee of experts. But if it's not at a bachelor's level, do understand you've spent a lot more time reading about that topic in the past 2-3 weeks, 1 month, than they would have done in the last 1 year. So you are the expert in that field. You just need to show it to them saying, this is what I read and this is where I found it and this is the evidence. So that will help you justify your work and will help you get through your proposal. My proposal for bachelor's was a lot of work, and a lot of people didn't think it could be done. But that's how I defended my proposal. Like, this is what I've read, and this is the edge of knowledge, and this paper and so citation tells me about it, and that's why I'm going to do this. And that got me through, and that research potentially was one of the causes that got me a PhD at UAB. So yeah, defending your proposal is also very important, and be sure you're prepared with it. Write all this information down in a table or whatever format is most accessible to you. But with that, I think, unless there are specific questions, that is the end of my presentation.
Yes, yes, we have received a couple of questions again. So if we are doing a research which is not a thesis nor associated with any association, so in that case, whom should we send or share the research proposal to? This is asked by Ms. Uma Maheshwari.
So if you're doing a research, I'm assuming you want to publish it. So here's one of the questions I had. If you're doing a research, you don't need to really put down a proposal like this if you're doing it on your own. But the reason you would want to put down is for the approval of ethics. And you need to find out which is the closest institution that can give you ethics approval. It could be your local optometry college. If they do some sort of research, they might have some IRB, and you don't need to share a lot of details with them. Of course, you would do the research independently, but you still need to send them an ethics proposal. and that proposal will include all of this information. But if you're if you're an independent researcher, the proposal is basically your own guideline. No one needs to know about it. But at the same time, in today's world, you need to have an ethics clearance from somewhere, and that committee would be the place where you send the proposal, or mostly the place where you're going to get your resources or funds from. If you're doing a research under an ophthalmologist, you ask him if you can do a verbal chat and it works out, great. If he's the one who's providing the patient or any clinical data, past and present clinical data, then yeah, that would be the places. Anything that will give you approvals from the committee and resources, like if you're working under someone and you're going to be using their time, like they're paying you for your time and you're using that time to do your research, then yeah, a proposal needs to be sent to them to say, hey, this is going to require a so and so, like only 15 minutes of the patient time and only 10 patients in the span of months, so can I please do it? So yeah, those would be your places where the proposals would go.
And could you also tell us how do we approach the patient into our research for our research topic?
That is more into once the proposal is approved and you have the ethics clearance, you have everything set up. That is a complete different talk in getting consent, informed consent from your patient, and informed assent if you're using minors or someone under 18. There's a whole different set of guidelines for using underprivileged population like prisoners or elderly, etc. So yeah, you have to have an informed consent or assent depending on who your population is. But yeah, that's a whole different new talk, and you would have to approach the patient basically with that document saying, would you be interested? Explain all the steps, give them some time to read over the document or help them read over if they don't understand the language it's written in, and make them sign the document saying they're agreeing. Also make sure they understand that they are free to walk out of your research at any daytime possible if that is one of the clause. All their implications. If you're going to fit children with contact lenses, you have to explain to their parents, which I'm going to do. You have to explain to their parents that contact lenses do have certain amount of risks, and the parents have to know that what is the risk, and they have to agree to all of that. So yeah, that's a whole complete new process. It's too short of a time to explain that. But yeah, an informed consent is the word you're looking for. A Google on informed consent would give you a lot of the information.
Thank you so much, sir. That was indeed a wonderful presentation, and I'm pretty sure our audiences have not only enjoyed it, but also learned something of value today. So we're done with the questions now, and on behalf of ForOptom team and our audience, I would like to thank Mr. Keyur Savla for giving us the time and the knowledge and the lovely experience. And I would also like to thank our audience for being as wonderful as ever. And this brings us to the end of the session. We will be back with more programs and sessions. Meanwhile, please like the video, subscribe to our channel. You can also visit us at www.foroptom.com. Stay tuned for more sessions, updates, and we will be talking about this topic more in this week. So stay connected with us, stay home, stay safe, have a good day. Thank you.
Thank you.